let's start with that frontline question and testing. John Driscoll, hello.
Hello, Anita.
Hello. Hi, John. John, calling from Manchester, and I know sort of medicine is a little bit of a family firm business, isn't it?
It is, yes. Most of the family are medics. I'm a hospital consultant, but I'm not involved in the front line. But my 3 children also work at the NHS, and they are on the front line. So I'm very worried about them because they've been put at great risk because of the failure to provide adequate personal protective equipment. And if in the environment within which they work, they do get infected, it's likely to be with a high viral load, a lot of the virus, which even in young people is significant from a mortality viewpoint.
Well, can we just pause there, because there are some bits of jargon there which may need some unpacking. So viral load, just to really simplify it, is how many times you're exposed to the virus, and it's almost like you sort of get a ration each time you're exposed. And if you have a high viral load exposure, that means you're hitting a higher percentage point than somebody who just has one exposure. Is that right?
No, it's more that the initial infection, if you get a lot of the virus at the same time, then the implication of that, it is more difficult with the body's immunity system to deal with it. So it depends on what sort of dose of the virus you actually come across when you're infected. And people working within the acute care NHS environment and intensive care, if something goes wrong, the patients there are likely to come up with an awful lot of the virus, and then you might have a high viral load, which is that there is good evidence coming out that people who have an initial high load at the beginning have greater problems as their disease progresses.
So you can be young, you can be fit, you can be strong, but if you're exposed to that high viral load, then you're going to struggle no matter who you are.
You might struggle. You're more likely to struggle, yes.
So what are your children telling you about what they have in the front line and what they need?
Well, there's one of them actually working on a respiratory unit, and I think there are just concerns there that it's not adequate, the actual protective equipment that they've got. There are discussions about exactly what level of protective equipment is appropriate within various circumstances, but they certainly haven't got the adequate at the moment. There is not adequate protection.
When you hear politicians, and they have taken great pains to say how much they appreciate the work of the NHS, we all, hopefully, most of us went out and clapped for the NHS this week. Are you comforted that, look, politicians get it, and if they didn't get it before, they get it now, and they are doing everything they can?
Well, the problem there is that it was clear months ago that a serious pandemic was quite likely, and that if this happened, that there wouldn't be sufficient numbers of ventilators or personal protective equipment to cope here. And I find the failure at that stage to initiate these steps that are taking place now is inexplicable. And they do continue to avoid answering the question as to whether they regret not taking steps earlier. They say very good things with platitudes about the amazing and incredible NHS staff working in the NHS, and that they're ramping up to produce thousands of this, that or the other over the coming weeks. And that is all very good, and that's right. But I think it is important to look back and to ask questions about why this was not done initially.
Thank you very much for your call, John. Raju Sakaria is calling us from Dover. Hello, Raju.
Hi there. I sort of echo quite a lot of what the first two sort of callers raised, but I have a slightly different angle, which is that I'm actually struggling to see what the rationale behind the scientific advice provided to the government is. Again, like the first, sort of caller, we knew this infection, we knew that this pandemic was on its way. We know that coronavirus spreads very quickly, so we needed to have an appropriate and rapid action, but I couldn't actually see any plan. So, like the first gentleman, I agree that protection equipment for frontline staff should have really happened no later than beginning of this year. So that's the first thing. But I think equally essential is planning for testing that takes into account the fact that the virus is more effective at spreading. So like the last caller, yes, you can, sort of be asymptomatic but be spreading the virus, but there are actually studies now done that show that, it spreads far more rapidly during the early stages. So you need to test for the virus itself, not just the antibody. And
Can I just ask, do you have a science background yourself?
Yes, I'm a biochemist, and I used to develop diagnostic tests. I'm retired now. So,
okay, all right.
From that perspective, and then you would test for the antibody, but at that stage you've already had the infection, and that tells you if you can go to work. But you need to test for the virus first, so that you stop that sort of rapid spreading of the virus. And, Germany's been very, very effective. They've had a really good plan, and they've actually got very few sort of, deaths as a result. Whereas we didn't seem to have a plan, and there's so little happening. Can I
just give you the German figures? I mean, it's good to have proper concrete figures when we discuss these things, and the figures are horrifying. Of course, they are.
Yeah.
So currently, Germany has over 47,278 confirmed COVID-19 cases, and including 281 fatalities, and that compares.
Effective, haven't they? They've, because I think they started testing early, and if you're dealing with this quite early on, you are actually sort of more effective at this. So I don't know why we haven't done that. And
okay.
I think,
yes, go on. Go very briefly, Raju.
So I think the bodies that have advised the government, I think they should be called to explain the rationale behind not having a plan that I could see anyway. And I think
yes, I mean, just on that point, I mean, it is a large body of scientists who are working in the field right now, who are, a consortium of scientists who are working in SAGE, who are, one would hope and presume, sort of au fait with up-to-date numbers, methodologies and everything else. Why is your faith in them shaken so much, Raju?
Well, because, we started testing, then we stopped testing, then we decided that we would have this, groundbreaking test just for the antibody without testing for the virus. And now we've decided to go towards a much more rational sort of plan, which is good, but we're doing it 3 months down the line. So that's
I've just heard scientists before sort of saying, look, if we do start, science moves on with data and information that's collected, so that these things shouldn't be seen as and as a scientist yourself, I mean, I guess you'd know this better than anyone, these things shouldn't be regarded necessarily as handbrake turns, but developing policy that changes with the developing picture.
That's true, but so again, I'm going to use Germany. They have actually used China and Italy as an example to sort of guide their planning. And I think we left procurement of things like protective equipment till quite late. Our testing has gone backwards and forwards. So I don't really know that it could be claimed that way.
Okay, all right. Thank you very much for your call. Appreciate it. Julian Peto is calling us from Witney in Oxfordshire. Hello.
Hello.
Hello there. So I did do a little call a bit earlier for somebody who might be doing research that was pertinent to the times that we're living in right now, the advice that's being given to the government and the advice that the government is passing on to us. And here you are, Julian, like a genie out of a lamp. Tell us what you do.
Well, I'm a professor of epidemiology. I mean, normally I study things like cervical screening, but I mean, for the last week I've been, like everybody else, frantically badgering the government and everybody else to chip in with my bit of advice.
And what has your advice been?
Well, one of you earlier callers said everybody can't be tested, and that's the key point. I think they can, and the reason they can, it requires 1,000 times more tests than they're doing at the moment. It would take about 10 million tests a day to test the whole population once a week. But I think it's feasible because the machines that are used for doing the test are in every lab in Britain. It's called a PCR machine. But I mean, every lab in Britain, every biology lab in Britain, and every university, and obviously a lot of huge commercial organisations, have enormous numbers of these machines doing all sorts of things, from HPV testing to sequencing genes to you name it. But if they all dropped what they're doing and went over to doing this test, you could actually test everybody in Britain once a week, and that would stop the epidemic, and we could end lockdown. And it's the only way of doing it, whereas either being locked down until there's a vaccine in 2 years' time, if we're lucky, or letting it rip and killing 200,000 people.
Julian, just on that point, I mean, you're saying every week, and one of the emails actually said, this thing about antigen testing, it only tells you that someone's healthy right here, right now, not if they're going to be healthy in a few days' time. So you're saying a weekly test, is that right?
You diagnose cases earlier. As an earlier caller made the very important point, a lot of the infection is spread by people who have no symptoms. And so there's absolutely no other way of picking them up. But if everyone's tested once a week, you'll pick them up quite early. I mean, that'll have affected some people, but you'll reduce the rate of spread dramatically. If the minute someone's infected and everyone's tested once a week, they and their family go into quarantine and they then try and remember who they've been in contact with and you chase them up. And the other thing is, of course, if you tested everybody once a week, you know instantly if there was a little flare-up somewhere. You know within a day if there was a flare-up somewhere, because different people will be tested on different days.
Yeah.
You see exactly where the epidemic is, but mainly you identify new infections as rapidly as possible, and you put them and their families in quarantine immediately.
Yeah. I mean, you're a professor of epidemiology, and you're based, are you, at the London School of Hygiene and Tropical Medicine? Is that correct? So I'm not turning you into a spokesman of any sort, but just anecdotally from when you're talking to fellow academics and professionals around you, what are they saying about our country's response compared to other countries' responses?
Well, I don't really want to get into that. It's not a blame game, but I'm making the more important point that we can end lockdown without 200,000 deaths and without destroying the economy. I mean, I think that's a far more important issue than whether Germany's ahead of us or behind us. I mean, South Korea hasn't controlled it. I mean, in Daiju, where it started, they've gone from 500 cases a day to 20 cases a day because they locked the place down. But in the rest of South Korea, it's actually creeping up.
Okay, so going down the pathway that you want to go down, then let's stay there. And is it possible to get that many tests? And how quickly can we get that many tests?
I think it could be done immediately. If there was a national appeal to every lab in Britain to log in and register how many PCR machines they've got, then the only obstacle is getting a protocol, which will take about 2 days, and getting British Biotech to manufacture 10 million kits a week, a day, which I think they could do.
Okay, well, that is a substantial amount of food for thought. Thank you very much for your call.